My name's Sue Evans. I teach at Southern Cross University. I'm a herbalist, and today I talked about integrative medicine and how herbal medicine and integrative medicine might work together. And I gave a historic, I suppose, perspective on that, starting off by looking at why integrative medicine is an issue. And it's an issue because at the end of the 19th century, there were many systems of medicine, none of which was particularly advantaged over another system of medicine. Then from the end of the 19th century, beginning of the 20th century, biomedicine became dominant over the other forms of medicine. It went through a process of professionalisation, got statutory regulation. And then for the best part of the next century, until the end of the 20th century, really spent a lot of energy in actually keeping its competitors down and out. In the talk I looked at some of the reasons that are given by Sachs, or some of the methods that were given by Sachs as to how this happened. And one of the ways that they maintained their dominance was by forbidding their members, by forbidding medical practitioners for working with non-registered practitioners. So it wasn't legal for doctors to work with herbalists or homeopaths. If we come to the end of the 20th century, and I talk about the fact that the golden era of biomedicine can be seen as the dark ages of herbal medicine and homeopathy. End of the 20th century, we all know there was this great increase in interest on the part of the public in terms of all forms of natural medicine, and some doctors started to move against their professional associations and started to work with non-registered practitioners, and this was the beginning of integrative medicine. And in the talk I gave some of my own experiences of working in the first integrative medical clinic in Melbourne, which was the Whole Health Clinic in Fairfield, and I was working there in the 80s and 90s. And I talked about some of the strengths and weaknesses, as I saw it, of that clinic and of that experience. In the talk I then moved on to what's happened, in the last 15 or so years. As we all know, natural medicine has gone from strength to strength. There has been, in terms of herbal medicine, that's been a strong increase in the evidence base for many of our medicines. But what I then talked about was how our thinking scientifically, thinking biomedically, has actually changed the way that we understand our patients and their diseases, but also how we understand what our medicines are and how they work. And these changes have enormous ecological impacts, because one of the things that's happened as herbal medicine becomes more mainstream and we're using more and more products, we're not using herbal teas, we're using capsules and tinctures, and these capsules and tinctures are becoming more and more concentrated. The concentrated extracts are being backed by evidence-based medicine, and when the actual raw material that's used for these plants is something that's freely available, like St John's wort, which is a noxious weed in many parts of Australia, that's fine. But when the root of the plant is a part that's used, and when the plant it grows in a specific part of the world, or there are some difficulties in harvesting, or it's difficult to cultivate, then we do need to pay attention to the ecological consequences of natural medicine. I'm a herbalist, and so I didn't go into the other modalities, but I think the same question can arise with fish oils. We think fish oils are fabulous, and we do more and more research on fish oils. But what about the fishes? Are we harvesting out the fishes by doing this? And what is this? I think that it's the responsibility of naturopaths and herbalists to bring nature to the forefront of the equation. It's not okay that we're part of extinction of species.
So my name's Dr. Jen Hunter. I live in Sydney and work in an integrative clinic in Sydney as a GP and integrative medical practitioner. I use a range of different therapies, from Western biomedicine through to Oriental medicine and traditional Western naturopathy. I also work with other practitioners, and so we jointly manage patients together, and also I refer patients outside of the clinic to other natural therapists and specialist doctors as well. So today I was asked to talk about what works, and I thought I'd focus on the issues around using evidence-based medicine and Western scientific methods to assess whether herbs work or not. So it's a contentious area, and although we're all very happy that finally there is some evidence that herbs work, I'd like to take it to another level again, and for us to appreciate that once a herbal product is turned into a pill or a liquid extract or capsule, each of those products is distinct in some way and will potentially have different properties, different pharmacological actions, and different slightly different concentrations of the chemicals within it. So we can't just say, for example, all St John's wort products are the same. They're all potentially different products. And I think that's very important that we appreciate this when we're interpreting the evidence. And it may also help explain why a lot of the bigger, what are they called, meta-analyses that are used when they suddenly combine all the clinical trials on a particular herb, suddenly come up with inconclusive results. It might just be that the herb doesn't work or the clinical trials weren't particularly well designed, but it may also be that we're not comparing like with like and they're actually different products. Even the delivery system can be different and affect its outcomes. The other thing that I touched on and that Sue very nicely went on to talk about is the challenges with this newer modern phytotherapy is that we're starting to use herbs and prescribe herbs like we do drugs and pharmaceuticals. And although it's great to have this as an option for our patients, there's obviously a demand and people want to have the opportunity to take herbs as an alternate to pharmaceuticals. One of the problems is that we're losing the tradition of the practicing and prescribing of herbal medicine. And that includes things like principles of holism, individualised medicine, where you're really tailoring all the ingredients together to make a unique product for that person. It also means that it's much harder to control and to balance all the other components and problems that someone might have. And suddenly a person can be taking 5 or 6 different pills.
Hi, well, I'm Mark Cohen and I'm Professor of Complementary Medicine at RMIT University in Melbourne, Australia. And today I got to speak about a project we're doing using acupuncture for pain relief in emergency departments in 3 hospitals in Melbourne, the Northern Hospital, the Epworth Hospital and the Alfred Hospital, and really how that evolved. And that's been a journey, it's an ongoing journey, but we've got to the stage now where we have a federal government funding, over $400,000 to fund a randomised controlled trial. It's actually 3 trials looking at acupuncture for pain relief for back pain, migraine and ankle sprain. And our primary outcome measure is pain after 1 hour. So we're looking at how effective is it in the acute situation, and then we're looking at things like how long people stay in the emergency department, how they feel a day or 2 after, and then looking at health economics in terms of, is it cost effective for employing acupuncturists to do that. And we've actually got 2 full-time acupuncturists employed doing acupuncture in emergency departments now, which I think is a world first. So we're very excited to be doing this, and we hope to have the results by the end of next year. And we know though that pain itself is the most common reason that people come to an emergency department. And we also know that in the emergency department, pain is not treated well. There are a lot of people who remain in pain in the emergency department despite the access to all the drugs and the modern technology. And the emergency physicians that I've met are very pragmatic people. They see if something is safe and it's going to benefit their patients, they want to use it. And I've been very lucky to meet emergency physicians who have themselves taken it on board to do that and seen the benefits for themselves, and then support and shepherd the use of acupuncture through that system. So yeah, it is a bit incongruous. We're using this ancient, many thousands-year-old technology, which is just a needle, in a very high-tech environment. But the patients are open to it. We have now the doctors open to it, and hopefully we can get the scientific community and the general clinical community open to it as well, and really have integration of modern technology, ancient wisdom, and hopefully the patients will be the beneficiaries.